I am Howard. I had a very sick disease called addiction for over 50 years. That's the only way I found pleasure in life.
I see people every day who are in incredible need and who have incredible dignity and strength at the same time, who really need our help and our respect to lead lives that are dignified and healthy. I'm leading the Apricot Study, which is a program to help people who are chronically homeless and making the transition into housing, to make a successful transition and to reintegrate into society.
Only one addict understands another addict because they've been there, sat there, slept there, hurt there, cried there, and with me have turned 180 and are able to help others. I want to get it out to the world of how Apricot, with funding, additional funding, can help grow instead of 100 men, 200 men, 400 men, whatever the case may be. It just takes money and initiative to help more people. And that's why I'm here. I'm very proud of where I am today.
We're putting together one of the largest studies conducted in children in Canada to understand which milk fat is better for children. Nearly every child consumes milk in Canada, and today we just don't know what the right fat content is. We live in one of the wealthiest nations in the world, yet 1 in 4 children in Canada live in poverty. And we know that the origins of chronic disease start in childhood, and children who live in poverty are at much higher risk of chronic disease and many of the issues that we're trying to tackle at MAP. We need to solve this. We need to get all children to be as healthy as they can be, so they can live long, healthy, and prosperous lives.
Millions of people in Canada don't take medications because they can't afford to. You can wait until someone has a heart attack or a stroke and then provide them with a treatment for high blood pressure, or you can try and address the issue before there's a real problem. And what we're trying to do here is solve some of the big problems in society that result in people ending up in the hospital with a heart attack or a stroke or ending up dead.
We are addressing the issue of the high apprehension rate of Indigenous infants.
Many Canadians are not aware of there's more First Nations, Inuit, Métis children in care now than at the height of the residential school era.
My goal for this study is to show how we can build on the resilience of Indigenous communities to support these women so that they have strong families that are thriving.
The name of the study here is to disrupt the opioid overdose epidemic. And what we're trying to do is identify ways that we can both reduce the risk that people experience overdoses now and also try to prevent future cases of fatal overdose. While addiction is a really complex issue, the solutions to preventing overdose are really quite simple. We need to provide resources to people who are at highest risk, like addiction treatment, wraparound care, harm reduction services, so that we can prevent people from dying. And the thing that is standing in our way is stigma. Really what we've got is a poisoning. We have a mass poisoning, and that's what we have to deal with.
I'm Dr. Pat Ocampo.
I'm Dr. Jonathan McGuire.
I'm Dr. Dan Werb.
I'm Nav Prasad.
I'm Stephen Huang,
I'm Dr. Janet Smiley, and I'm with MAP,
the Center for Urban Health Solutions at St. Michael's Hospital.